Welcome. Thank you everybody for coming and visiting and watching this new series. It's called Critical Issues Facing Teens. My name is Jennifer Grady and I am the Campus Intervention Specialist at the Learning Center. I created this series because we have seen an increase of student or teen drug usage over the past few years, especially at the middle school level. And I felt like there was a need for some sort of education program for parents and students to learn the effects and the consequences of drug usage. I want to thank these ladies you're going to see tonight for their time and their collaboration and their expertise in putting all of this together. Our first session is called The Whole Student, and I know that these ladies are just as passionate about this topic as I am. So I'm going to turn it over to them and let them present.
Okay, first I kind of wanted to talk about who we have with us tonight. You just heard from Miss Grady. She is the Campus Intervention Specialist for the Learning Center. In the room, we also have Miss Cynthia Cook-Brown. She's Ag News Student Success Coordinator. We also have Miss Thorpe, who's going to be one of my co-presenters. She's Ag News School Nurse. I am Jennifer Estrada, the Intervention Counselor here at Ag News. And we also have Michelle Knowlton, who is Intervention Counselor at the Learning Center, and Kristen Anderson, who is a Behavior Specialist. All right, so one of the main things that we're going to talk about tonight is substance abuse and substance addiction. Okay, so one of the biggest differences between substance abuse and substance addiction is the withdrawal factor. And when we observe a person who's withdrawing, there's certain protocol that you kind of look for in symptoms to see where they are in the detox process. But with abuse or misuse, you have legal problems like saying getting arrested at school with some weed, that happens. Physical harm to others caused by the individual's use of drugs. Maybe you get in a drunk driving accident. Inability to do what's necessary at home, at school, at work, or to manage responsibilities in general. Ongoing use of drugs despite continued problems. Okay? So this is just abuse and misuse. When we get to addiction, we have those withdrawal symptoms. You have to use larger amounts to get the same effect. Losing interest in hobbies or school pursuits. Withdrawing from friends or family. Patterns of behavior that resolve solely around getting or staying high. Trying to stop and not being able to. And continued use of drugs despite these problems. The main reason we're doing this presentation is because we see commonalities in our students and the things that they're struggling with. So when we talk about drugs, I kind of listed these in order of which we see them occur in schools. So anything that's THC oil is considered a felony, as well as a lot of edibles. Smoking weed, like, rolling a item or putting it in a vessel of smoke is considered a misdemeanor. But if you have these on your person, you will be arrested and you will be going to the Learning Center. Prescription pills like stimulants like Adderall, opioids like prescription pain pills. This is a really big word, benzodiazepine. Those are your anti-anxiety medications that you get from a doctor like Xanax, Klonopin, Ativan, and sedatives like Seroquel, Trazodone, Ambien. Next, we see a lot of alcohol. And then after that, we see a lot of vaping with tobacco. Obviously, these are not illegal drugs, but they are illegal for a minor to have. Party drugs are the least common thing that we see in schools that kids have, but it does happen. And that's like your MDMA, ecstasy, Molly, LSD, mushrooms.
Okay, I put together information. So as the nurse, we're talking about the whole student. And what I would do if I was informed of a situation on campus or a student is as soon as I'm entering the room or the classroom, I'm looking at the child immediately. So I separated these in accordance to the drug use. But early stage intoxication, if we're dealing with weed, is usually loud talking, bursts of laughter. But if they've done weed a while ago, if it's the later stage of intoxication, sleepy, dazed, forgetful, inflammation of whites of eyes. The pupils is one of the main things I'm going to be looking for any type of drug use. You'll see eye reaction in a lot of these as signs and symptoms. But pupils are unlikely to dilate. Odor, similar to burnt rope on clothing or breath, and then brown residue on fingers. So medication, Jennifer was talking about different types. So stimulants like Adderall, if a student has taken Adderall. Once again, pupils, they're going to be extremely dilated. They may be irritable, argumentative, nervous, or talkative. Can also have bad breath, frequent lip licking, which can be common, difficult sitting still. Changes in conversation, so the student is going from one topic to the other frequently. Runny nose, cold, or chronic sinus issues, and that's all for stimulants. Opiates, prescription pain pills, that's something that you'll see in school. Okay. That's something that you'll see on school. And lethargy, drowsiness, constricted pupils. Once again, like I said, pupil reaction time is distinguishable between different drugs, different uses. We see Xanax and Klonopin and Ativan. Xanax, we've had that before. Effects can be noticed within an hour of somebody taking that. So you're going to notice drowsiness, lightheadedness. They may be sleeping for extended periods of time in the classroom. Cognitive impairment, so they don't really know what's going on. They're forgetful, sluggish, even nausea, vomiting, headache, dry mouth, delirium just kind of goes along with cognitive impairment. So they're not thinking clearly. Slurred speech, which is common for other substances. Vertigo is like dizziness, and impaired coordination, which would go along with vertigo, balance issues. So sedatives are the next topic, and that can be trazodone, Ambien, or Seroquel are just some examples. And obviously with these, you're going to see a lot of tiredness and sleepiness. These can actually also cause tachycardia, which is an elevated heart rate. So, I would monitor for that. Nausea and vomiting can be common in different, a lot of these. Body aches, which is an interesting factor. Clumsiness, weakness. Another thing with these, and it's more common with continued use, but tardive dyskinesia is a type of jerky, uncontrollable movement that you can see in these type of drugs if people are overusing them. And it starts with like movements, often jaw jerking or lip smacking. And then mental side effects, usually irritability, not thinking clearly, and trouble speaking. Alcohol and vaping is the next ones I want to talk about. And you're probably seeing similarities in a lot of these. Of course, with alcohol, you may see odor on the breath. So we'll be able to smell that. Intoxication or drunkenness. And then difficulty focusing, which is common for most. Glazed appearance of the eyes. So they might have a glazed overlook. Uncharacteristically passive in how they're acting and behaving to teachers or classmates. But they can also be combative, argumentative, or irritable. So depending upon the person, every person is different. And for longer use or prolonged use, you're going to see difficulty in schoolwork, maybe a change in relationships from different friends, maybe loss of memory, and like even interpersonal family relationships might change because of prolonged use. With vaping, irritability, shortness of breath, because of course it's a vaping substance, so it's going to affect the lungs. Fruity or candy-like odor, because that's generally what the vaping substances can smell sweet. Nausea, vomiting, of course coughing, They might clear their throat a lot because of the substances that they're inhaling. With prolonged use, you're going to see mouth sores, weight loss, chest pain can occur, and even seizures with vaping. And once again, that's not an illegal drug, so those are serious symptoms. So party drugs, MDMA, LSD, and mushrooms, with those, depends on what it is, but there's going to be, like, hallucination is one of the prolonged use if you're using party drugs. But dilated pupils, blurred vision. So you're kind of seeing a common similarity with a lot of these when it comes to pupil dilation, dizziness, blurred vision, disorientation. But with this one, they can have also tingling of fingers and toes. So that's an interesting symptom. Weakness, nausea, also tachycardia, which is an elevated heart rate, sweating or chills, anxiety, and paranoia. So, and like I said, hallucinations can occur with these, and sight and sound can be intensified and alter perceptions of speed. They feel like they're going faster than they actually are.
So I'm going to speak to you. We just kind of learned about what the symptoms look like. But now I'm going to talk to you about what's actually happening in the brain. So this graphic is pointing out three major parts of the brain that are affected. We have the basal ganglia, the extended amygdala, and the prefrontal cortex. So these are the main things that are affected by the brain anytime you take any substance in, even caffeine. So the basal ganglia, we just saw that on the little graphic there, is an important role in what gets you going in the morning, your positive forms of motivation, including like pleasurable activities like socializing, playing, things like that, eating, and it also helps you develop habits and routines. These areas form a key node, what is sometimes called the brain reward circuit. Drugs overactivate that circuit, so if you think about plugging a lamp into a light switch, if you unplug it and plug it back in, unplug it and plug it back in, you're eventually going to short circuit and have some big issues. You produce the euphoria of the drug high, but with repeated exposure, the circuit adapts to the presence of the drug, diminishing its sensitivity and making it hard to feel pleasure from anything besides the drug. So say, for example, before, you would really love to go and exercise or be outside or go swimming or something like that. And that's just not fun anymore because it doesn't bring the same excitement to you. The extended amygdala. It plays a role in stressful feelings like anxiety, irritability, and unease, which characterize withdrawal after the drug high fades and thus motivates the person to seek the drug again. This circuit becomes increasingly sensitive with increased drug use. Over time, a person with substance use disorder uses drugs to get temporary relief from this than rather to get high. And I want to speak to them for a moment about that. A lot of times we see kids who will drug hop, which means, like, say, for example, they will take a party drug like MDMA, and about after your high goes away from MDMA, you tend to have a huge depressive cycle. Like, you get super depressed, everything feels like it's super heavy, and so a lot of times people will then move to weed or another substance to kind of get that high back up. And then you're feeling sluggish from the weed, so then you might take cocaine. It's like a kind of a bad cycle that you can get into when you mess up these brain chemicals. The prefrontal cortex, which we talk a lot about in Mesquite ISD counseling, is basically your decision making. How you think, plan, solve problems, critically think, how to react to something when you're in danger, self-control over impulses. And the thing about this is this does not fully develop until about the age of 25. And so I hear from the students a lot of times, well, weed is legal in like 30 states. Why can't we do it? Well, for one, it's for adults. And for two, it's not legal here. But the reason it's legal for adults is because the brain is fully developed. And your brain as a teenager is not fully developed. So it's going to impact you differently. Okay? Nobody likes to hear that, but it's true. All right. So we shift balance between the circuits, the basal ganglia, the prefrontal cortex, and the extended amygdala, and they make that person up. And so when all of those things get off center, that's what makes you have the need to have the drug compulsively. And then you also have reduced impulse control. So you might think, I think it's a great idea to get in my car, go 130 miles an hour without a seatbelt on, and see what happens. So that's where we see that lack of impulse control. One other thing I wanted to point out is when we talk about these hallucinations, sometimes you take a drug and they're temporary. Like say you use mushrooms and you have that temporary period of hallucinations. But what we see happen quite a bit is something called drug-induced psychosis. And sometimes that never goes away. You get one bad trip or one bad dose, and then you are dealing with psychosis for the rest of your life. And I've worked inpatient and I've seen it in young people, and it's a really, really sad thing when you damage your brain in that way. Okay, so, and then we have another little graphic here. Depressants are things that slow you down. They slow down your respiratory rate, like those sedatives, like the benzodiazepines that we talked about earlier. They slow messages between the body and the brain. Signals from the eyes and other senses reach the brain slowly. And this is dangerous in like feeling pain. So if I'm touching like the hot stove, it's going to take a lot longer for that message to get to my brain that's like burning me. Your heart rate drops, leaving the body with less energizing oxygen. Your breathing rate decreases and risk of lung infections rise. Your messages to muscles are slower. Arms and feet, legs can't move that well. And the biggest thing is, like I said, the body can't sense or respond to danger quickly. On the opposite end, stimulants like Adderall, cocaine, things of that nature, you create fake messages in the brain telling the body that it's under stress. Blood to skin decreases. The body is less able to cool itself. Overheating is a risk. Heart rate speeds up. Blood vessels to the heart constrict. The liver releases sugar into the blood, reducing the body's energy stores. If real stress occurs, the body won't be able to respond. So the nurse and I kind of went over the physical and physiological impacts of drug use. And now our next speakers, Ms. Anderson and Ms. Nelson, are going to talk about behavioral, social, emotional impacts. So thank you guys.
The behavior specialist, that's what I do. So I'm just going to talk briefly about the behavior part of drug use. And I'm kind of speaking to parents and students on this one, because I think the behavior that goes along with a lot of the drug use can be very frustrating. And I think if we don't truly understand behavior, then we can get really confused about the intention or why the behavior is happening. So one of the things that I had on here too is just what is behavior? And there's a bunch of complicated things up there. But simply put, behavior is what we do. And it can be in response to feelings, action, or environment. So we just went over a lot of the parts. So we talk about brain development and how the drugs are actually going to affect your brain. So one of the things I want you to think about too is once you get on the, you're using drug use, and even if you get into addiction, now you're starting to respond to the environment or the brain chemicals. There's always a function or a reason for behavior. Every behavior has a reason. Every behavior has a function. So as we get into this, just always remember that a lot of times drug use can also be the symptom of some other behaviors that are going on. So it's the manner of conducting oneself, anything that an organism does involving action or response to a stimuli, or it's just the response of an individual group or species to its environment. So all of these things lead to behavior. All right, these are the fancy words that you can Google, some of you that want to go out and look. These are different types of behavior, but the type that I really wanted to focus on to help understanding, we have overt behavior and covert behavior. And so what I think is really important, we're pretty familiar with overt behavior, because this is visible behavior. This is what you're actually going to see on the outside. So the example, eating food, riding a bicycle, playing football. These are all behaviors that you see. Okay, but the one I really want you to make sure you understand, covert behavior, is unlike overt behavior. This type of behavior, it's not visible. And so I think it's really important to also remember thoughts are behavior. And so sometimes what we're seeing is the response to a behavior that's a thought. So that kind of takes it to another level too, especially when you start looking under the surface and you're like, okay, this is what I'm seeing. But what's going on in the thought process? Because that too is considered a behavior. No one can see what we're thinking. So a lot of times whenever students, parents, and people are involved in drug use, there's a whole nother layer that we don't get to because it's inside and we can't see what people are thinking. We're just seeing the response on the outside. So I'm going to challenge you too, if you are dealing with someone involved in drug use, just think a little deeper about maybe what's going on in the thought process, the step before sometimes, before you see it. And I think sometimes if we can dive a little deeper into intent or how did we get here, and we go a little deeper into the thought process, I think we can also be a little more productive with how we respond to some things. So basically, behavior can be seen or unseen, and drug use is a way to self-medicate for other behaviors. I think sometimes when we start looking at drug use, we just look at the drug use. Again, let's back up a step. What is going on in the thoughts and minds of someone that originally initiated the drug use? Was it depression? Was it anxiety? Was it feelings of isolation? Was it curiosity? But again, a lot of times, and not always, but sometimes the drug use is actually a symptom of something else going on. And the behavior of drug use is used to mask other things or behaviors or thoughts that people are having. Thoughts are behaviors too. If you walk away with anything, I want you to remember that. Thoughts are behaviors too. So the three main factors that contribute to drug use, it can be emotional, it can be physical or psychological. So there's a million reasons why people go to drug use. This is just three, kind of to put it in three big categories. Again, I can't list all the reasons why people go down this path. Emotional is feeling that they need the drug to fill a void in their life. Physical, feeling like they need a physical effect or a high or low to physically feel better. Or psychological, general negative feelings towards themselves or the world. The more you understand about the function of the behavior, then the more successful you can be in changing the behavior. No behavior has ever changed because we told it to. I'm going to say that again. No behavior has ever changed because we told it to. Again, we talked about the brain, and whenever we get into addiction, what's happening then, when you're in addiction, you're responding now to brain chemicals and brain signals that are happening, and you get on the loop. And so if we just deal with drug use, we might be able to do that, but then a lot of people will get help for the drug use, but then they go and jump into other risk behaviors or other unhealthy behaviors. So if you never take a step back and think about what is the function of the behavior, why did this person initially decide to go into drug use in the first place? So I think this is just a real easy place to start. Maybe the conversations that you have. What started this? Was it more emotional? Was it physical? Are we talking more psychological? But I think this is a good talking point too between parents and children too about just where are you at? Checking in with them on all fronts because you have to investigate. They're not just going to put it out there on the table for you. You have to go in, you have to ask questions, you have to communicate as a family. The symptoms of addiction, there's a whole bunch on here about, and we went over a bunch of them. Things that you need to remember is when we're talking about addiction, the brain is operating on a different track. It's on that reward system. So even if you know that drug is bad for you, you know it, you can tell people it's awful, I want to stop, I don't want to do it, it's ruining my life, and then they go out and use. From the outside looking in, that can be very frustrating. But again, if you back up and think about, okay, what's going on? Are there thoughts and behaviors that they're responding to? Remember, we can't just look on the outside. We have to go inward because thoughts are behaviors too. So some that were on here that can be really frustrating to see: spending money on the drug even if you can't afford it, not meeting obligations or work, cutting back on social or recreational activities because of the drug use, continuing to use the drug even though you know it is causing problems in your life. So these are behaviors that you're seeing. And again, these are usually a response to thoughts or addiction, brain chemical. Again, more of these, and these are on the PowerPoint for you guys to look, but failing in your attempts to stop using the drug, which again speaks to the desire to want to quit, but now you've gone into physical addiction. So again, the behavior is not just going to stop because we tell it to. Okay, now I'm done using drugs, so I'm ready to stop. Once you get on addiction, now we need to get in, you got to get treatment. We can help you. There's a lot of support. But again, at this point, you need to seek out treatment to change these behaviors that you've gotten into. Recognizing unhealthy drug use in family. There's a bunch on here that you can review, but the biggest thing I want to just say to anyone is you're looking for a change in behavior. So I can list a bunch of them on here, but basically, again, those conversations and getting involved and being embedded in the lives, you're going to notice behavior changes. If you have a quiet child who comes in and is just generally quiet, and all of a sudden you see a change, and all of a sudden you got a chatty Cathy at your table, that's a behavior change. If you have a chatty Cathy and they love talking and they're very out there, and then you start seeing them withdrawn and now they're quiet, that's a behavior change. Also, again, grades can be a behavior change. If you see a drastic change in grades, if you see a change in interest, going back to the brain chemistry, if they loved riding their bike and all of a sudden they're not enjoying the same things that they used to enjoy, those are behavior changes. They can be subtle or they can be big. But this is where you have to be mindful and embed yourself in the lives of your children, because they're going to give you signals. It's your job to pay attention and pick them up. They're not going to wave a flag when they come in the living room and tell you, hey, guess what? Today I was using drugs. I wish they did. But they're not. So you're going to have to investigate and get in their lives and be a little intrusive at times. Remember, your job is to protect your children and to be involved. And it's okay if your children are mad at you. I'm going to say that again. It's okay if your children are mad at you. They will get over it. And when they realize that what you were doing is for their health, their safety, and their well-being on the other side of addiction, when they're clear, they'll come back to you and they'll understand. So I think, too, as parents, we have to be okay with our kids being mad at us. So I may have opened a whole can of worms there, but did I have one more? Is that it? Preventing misuse. Again, this is just kind of basic stuff, but sometimes I think we try to make it more complicated than it really is. Communicate. Talk. I know teenagers don't want to talk, so don't ask them questions that they can answer with a yes or a no. Ask them questions where you have to get a response back. What was the best part of your day? Who's your best friend and why? Questions like that where you have to get some feedback. And then you just don't get the grunt. You know? Listen. Just listen. Don't have a comment. Don't judge. Just listen. If you can sit there and actively listen to your children when they have to talk about it, and sometimes they're uncomfortable conversations. But as parents, I think it's important for us to respond, not to react. And remember, at all times, you are modeling behavior for your children. So if your children come to you to have a conversation and open up to you, and you have a huge reaction, not only are they saying, oh, if I go, I know what's going to happen, but they just learned how to respond to something or react, just like you did. So remember, they're always watching. Set a good example. I'm going to say this to my parents who are working hard and you're doing everything you can do. Don't misuse alcohol or addictive drugs. Children of parents who misuse drugs are at greater risk of drug addiction. They're watching you. They're going to do what you do, not what you say. Love you. Strengthen the bond. Work on your relationship with your children. A strong, stable bond between you and your child will reduce your child's risk of misusing drugs. And I always say lead with love. So again, I know we're talking about behaviors that are frustrating and drug abuse, and these aren't easy topics. But I think too, if your intention is always with love, then behaviors can change. It takes time and patience. All right, I'm gonna hand it over to Ms. Knowlton.
I'm going to talk about emotions and problematic use. Problematic use is just another way of saying drug and alcohol abuse and building resilience. First of all, what is resilience? Resilience is the ability to overcome setbacks and challenges and then grow from the experience. Why is she talking about rubber bands when she's talking about resilience? Well, when you stretch a rubber band, it demonstrates resilience by quickly bouncing back to its original shape. However, if the rubber band is stretched repeatedly, it loses its ability to return to its original shape because it now lacks resilience. This is what happens to the mind and or brain as a result of problematic use. Problematic use or addiction is a chronic disease characterized by drug and or alcohol seeking and use that is compulsive or difficult to control despite harmful consequences. And this is a picture of the pleasure center of the brain, which is activated during addiction. The fact is that repeated drug and or alcohol use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist the intense urge to take drugs or drink alcohol. Emotions associated with problematic use are depression, anger, fear, loneliness, shame, apathy, guilt, and anxiety. And I wanted to point out one of the most problematic ones, which is apathy. This is when you become the kind of person who doesn't care about anything. So, parents, pay attention to your adolescent or teen emotions and behaviors. Are they stressed? Is there a loss of interest? Are they avoiding things? Are they overwhelmed due to added pressures or responsibility to compete? Are their grades lower? Is there trouble at home, at school, or at part-time work? Is there grief or loss that's unaddressed? Are they isolated? Are they disconnected? Do they have increased anxiety? Are they sad? Do they have reduced mental energy? Do they have a lack of appetite? Do they have trouble sleeping? Is there unresponsiveness? Is there increased appetite? Emotional risk factors for problematic use: childhood physical, emotional, or sexual abuse, distant or neglectful parenting styles, being bullied, domestic abuse, surviving natural disasters, especially when there has been a loss of life, like in the family or among friends, losing a loved one due to death, divorce, or desertion. Use, there's a cycle of addiction. There's use, then it can turn to abuse, and then the drive to reuse. Why? The reasons people use drugs are usually to avoid intense emotional or physical pain, to increase their confidence to engage with others, to create an optimal numbness where they can escape the painful events or sadness in their lives, to search for meaning when there is grief or loss, to fill a void made by loss of connections, to help them go to sleep, to mitigate feelings of overwhelm, to deal with parents, guardians, or rules associated with parents and guardians, and to manage daily stressors. Emotional reactions to problematic use: guilt, when you're aware of the stress and heartache caused by your alcohol or substance abuse, you're aware of the stress and heartache that causes to your loved ones. The guilt begins to chip away at the abuser's self-esteem, and it makes it even more difficult for them to quit. Fear, the fear of the stigma of exposure and possible loss of relationships, employment, and personal dignity when others discover the truth about one's abuse. The fear of losing everything that is valued most, including the user's own health and freedom. Depression, the haunting feeling that prevents users from achieving their goals, meeting personal responsibilities, and controlling their fate. It leads to changes in the brain. More emotional reactions: anger, the feeling of anger at oneself or your own behavior. Anger at your family and friends when they try to confront your alcohol or drug abuse. Anger at the world for abandoning you and leaving you without hope for a better future. And finally, apathy, giving up on yourself after a certain point. This is the dangerous stage of addiction. If you find yourself experiencing apathy, please reach out to someone and get help quickly before you drown in your own despair. What problematic users should know. Drugs and alcohol magnify any dysfunction in your life. So as bad as it may seem, this is only going to make it worse. The human brain is resilient. With time, it can create new pathways and replace those burned out by alcohol and drug use. And I'm really talking to younger people when I say this. With hard work, you can rebuild your willpower. It's easier to survive a bad day without drugs and alcohol. It's easier than it is to rebuild a hard life that results from becoming dependent upon drugs and alcohol. You can learn coping skills that will help you manage your emotions in positive ways. You matter, and we all benefit when you face the world soberly.
Okay, so I just wanted to come back and finish this up with some continued learning for you guys, and I'm sure that this is going, first of all, if you or someone you know has a problem with addiction, and there's the mental health aspect, and like Ms. Knowlton was saying, unless we address both, it's not going to solve the problem. We don't talk a lot about drug substance abuse programs in the area. Your school counselors, your intervention counselors, behavior specialists can give you lots of resources for mental health. But I wanted to give you some ideas of treatment centers in the area. Nexus is really only for girls, but they're fantastic. They have both residential where you go and stay for however many days, or they have outpatient services, and they're over kind of behind Eastfield College and La Prada, that area. The teen recovery program at Children's Medical Center, and that is kind of a drive for our families. It's down by the big children's hospital. They have an intensive outpatient program where you go Mondays, Tuesdays, and Thursdays from 5 to 8 p.m. and do group therapy. And then you also will see a counselor on your own there. And so this is after you've already detoxed and all of those things. And it's just kind of keeping yourself clean. And Phoenix House in Texas, they are kind of a place where you can detox. They have your residential and outpatient like Nexus, but they take both boys and girls. Both of these all take some form of Medicaid or insurance, and they also have ways where you can get that funded privately if you need to. So just reach out, and if none of these work, reach out to either myself, if you're at Agnew, or at the Learning Center. You can reach out to your home campus counselor or to one of the counselors there at the Learning Center. And then last but not least is some continued resources. Finding help for your teen, again, is going to kind of give you some more resources. There's the science of addiction if you really want to get into the brain function. It's also presents a lot of the same material that we presented to you tonight. And this is the National Institute for Drug Addiction. They have a special teen website for teens to actually look at. So it's not just for the parents, it's for the teens. And then I'm going to let Ms. Grady kind of close this out with what this program is going to look like in future presentations. Did you want to say anything, Ms. Cook Brown? Thank you guys for being part of this tonight.
Thank you so much. So our plan is to continue these sessions hopefully once a month with different topics each month. And I'm going to pull some resources from outside. And I'm so thankful that for everyone who is volunteering to help me with this. This is something I'm very passionate about, and it has become my new project. So thank you all for joining us. If you need any help or have any questions, please feel free to reach out to any of us. And we can, if we don't have the answer, we will find it for you. Okay? Thank you. Woohoo! Bye, guys.